Glad to have you here. You're welcome. Previously, I did videos on some NMC OSCE assessment tools and their nursing diagnosis, possible nursing diagnosis. I'm going to give some interventions on each one. So today, I'm doing MUST, Malnutrition Universal Screening Tool, the nursing diagnosis and some interventions for your planning station. So the tool is MUST, and it is used if you are doing assessment on diabetes. The nursing problem is risk for number one is risk for malnutrition, and it's related to diabetes, or it could also be related to poor appetite, depending on what your patient told you during your assessment. So if the patient said, I've not been eating well because I don't have appetite for food, then so it could be related to that poor appetite. The evidence is your MUST score of greater than 0. So it could be 2, it could be 1. Then your goal should be that Mr. X, that is your patient, to have reduced risk of malnutrition with MUST score of less than 1. Then you can re-evaluate weekly, monthly, or 2 to 3 monthly. So you can use after your MUST assessment, the intervention or the outline, clinical response. So you are given also when to review. You can use that here. Could be weekly, monthly, or more. So the interventions, you assess or monitor fluid and food intake and output. Then you advise Mr. X on healthy diet and its importance, and then encourage more frequent meals and snacks. So the next one is poor or inadequate nutrition. It could also be related to it's related to diabetes or poor appetite. Yes, if the patient said he's not been eating because of no appetite, so it could be related to that. Evidence can also be your MUST score, because it shows that the patient is not feeding well. Then you can re-evaluate as this applies here also. Then even the interventions, you can use the interventions here for this. Now, if you are in planning, during planning, we are using risks for malnutrition, it's better not to use two nursing problems that the interventions could be similar. So if you use this and this, the interventions could be similar, and you can find yourself writing almost the same interventions, and you could they might not allow that, and you could have report like your nursing care plan. The two nursing care plans are similar, or you have two nursing care plans that are similar. Avoid it. The next one is inadequate knowledge on illness management related to diabetes. The evidence could be your MUST score, because to have malnutrition, it means the patient is not taking care of himself or herself. So evidence by the MUST score or patient verbal account. So your goal could be that Mr. X will have improved or adequate knowledge of disease management. So you can reevaluate in hours or in weeks or months. The intervention, assess for knowledge level. You can also assess for areas where knowledge is lacking. So it's all included here. And they provide information on management. The information could be oral, leaflets, or online resources. Now, if you could do all, in oral information, you can, maybe the patient says, I don't know how to use the glucometer. So you can do oral, um, you can provide information, you can teach at that point in time, and you can assess it afterwards, maybe in hours. You can ask patients, you can assess it in hours. So leaflets and online resources could take weeks and months, maybe during your next visitation, or you can give patients a phone call. Okay. The last one I have here is risk for complication related to diabetes. The evidence also can be your must score, because it's a patient, or the fact that the patient is at risk for malnutrition. It means the patient is not taking care of the illness of herself well, so, and can develop complication. So your must score can also be your evidence. And your goal could be that Mr. X will not develop illness complication. Now, you can reevaluate weekly or monthly, and the intervention assess for signs like numbness of extremities and sight problems, and then encourage adherence to management plan. So now these are all I have for must. So an example here, name, date of birth, and hospital number already there. Then nursing problem, using what we did earlier. You could write Mr. X has risks for malnutrition related to diabetes, evidenced by, also related to, it could be related to poor nutrition intake or something, evidenced by malnutrition score of, depending on what you got, or inadequate, Mr. X has inadequate knowledge on diabetes management, or related to diabetes management, evidenced by his or her verbal account, or Mr. X is at risk for complication related to diabetes. Now, aim of care for risk for malnutrition could be Mr. X will have reduced risk for malnutrition, or Mr. X will have improved knowledge on diabetes management. Mr. X will not develop illness complication. To Then evaluation date to be re-evaluated today, the date of my OSCE every depending on when I will be assessing the patient according to the treatment outline every month, and as condition changes, a matter read applies here. So you can have explain, monitor. Then when you get to assess, you assess food and fluid intake for patients at risk for malnutrition, food and fluid intake and output. For if you are doing on knowledge, you assess Mr. X knowledge level or assess for signs of complication. Example I mentioned, numbness of the extremities and the vision issues. That's for the assessment. Then T, what are you going to instruct patients for malnutrition, risk for malnutrition, healthy diet, and the importance of healthy diet? For inadequate knowledge, provide information on the diabetes management via oral, leaflets, or on online resources. For risk for complications, you can teach patients on the importance of adherence to management plan in reduction of complication. Administer prescribed medication, assess for effectiveness and side effects. The next one, refer patients to diabetic nurse or community health nurse. Then the I, instruct on the use of call bell and documents all care as planned. That is it. Sign your names, sign and date. Then self-care, if you're still doing that, or Mr. X understands all aspects of his care and was able to give consent. Mr. X was able to use the call bell when assistance was needed. Mr. X participated in all aspects of his care. Right? Thank you, and have a nice day. Bye.